Blood levels of vitamin D and periodontal treatment. Sun is always lovely, even on the picture, but it is a source of life and the source of our vitamin D. Vitamin D blood levels had been intriguing healthcare industry for over a decade now. Many health experts consider benefits of vitamin D one of the most important discoveries of the past 100 years. Confusion about different ways vitamin D affects homeostasis, questions about supplementation, and undeniable number of deficiencies have been attracting attention to this superstar vitamin. I would like to review its function in relation to periodontal treatment and any healing process and give suggestions for supplementation and monitoring of blood levels. My interest in vitamin D topic was not so gently prodded by a real-life drama of the periodontal practice. Non-healing implant placement sites, infected implants without signs of infection, poor healing. Slaying infection dragons gets old in the age of antibiotic-resistant bacteria. I was motivated to dig deeper into the topic of immunity, which led me to the vitamin D research. It is always good to remember that periodontal disease is systemic. This concept is like a light bulb that shines the light on connection to the rest of the body. So let's review some facts about vitamin D. Vitamin D is a group of fat-soluble corticosteroids responsible for increasing intestinal absorption of calcium, magnesium, and phosphate, and multiple other biological effects. In humans, the most important compounds in this group are vitamin D3, also known as cholecalciferol, and vitamin D2, ergocalciferol. The major natural source of the vitamin is synthesis of cholecalciferol in the lower layers of skin epidermis through a chemical reaction that is dependent on sun exposure, specifically UVB radiation. Cholecalciferol and ergocalciferol can be ingested from the diet and from supplements. These are quotes from Wikipedia. Though historically called a vitamin, it is really a hormone that at optimized levels called calcitriol is now understood as the most potent corticosteroid hormone in the human body. At optimal levels, its effect extends far beyond bone support, showing responsibility for many health-promoting processes in the body. For the past 80 years, it was believed that vitamin D was only important for regulating calcium and protecting bones. At levels below 45 to 50 nanogram milliliter, this is vitamin D's main role. However, new research reported by Vitamin D Council, vitamindSociety.org, had shown higher levels of vitamin D may have much greater role to play. For instance, when vitamin D levels are between 50 and 80 nanogram milliliter, excess calcitriol, corticosteroid hormone form of vitamin D, heads toward the cells, not the bones, where it targets over 2,000 genes, about 10% of human genome. It's mind-boggling. This overflow of calcitriol has created a worldwide stir about the pervasive role of optimized vitamin D. At low levels of sun exposure and vitamin D, this overflow simply doesn't happen. The role of excess calcitriol in the cells is only now being understood. That's a lovely picture I couldn't miss. Have some fun in the sun. The common misconception is that if sun is shining, we can get all our vitamin D from being outside. Not always. The UVB rays that make vitamin D in the skin only penetrate the Earth's atmosphere when the sun is basically perpendicular to the Earth. In the winter, in any latitude north of Atlanta, The sun is too low in the sky for the UVB rays to penetrate the atmosphere, hence no vitamin D can be produced in sun-exposed skin from October to March. Even in the summer, the morning and evening rays are too low in the sky. During summer months, UVB rays are the strongest between 10 a.m. and 2 p.m. For most people, 10-15 minutes of direct sunlight exposure on unprotected skin during these hours would be enough to manufacture about 10 to 20,000 IU of vitamin D3. We need just enough sun to turn the skin slightly pink. Darker skinned people will have to get more sun to optimize their vitamin D levels. Dark-skinned people are less efficient at making vitamin D because melanin in the skin hinders vitamin D synthesis. Vitamin D deficiency is common in Hispanic and African Americans in the United States, with levels dropping significantly in the winter. This is due to the levels of melanin in their skin as it acts as a natural protectant from sun exposure. All this is from Wikipedia. Vitamin D metabolism. The two forms are vitamin D2 and vitamin D3, also called ergocalciferol and cholecalciferol, respectively. Vitamin D3 is produced in the skin in response to ultraviolet B radiation from sunlight, or can be obtained from the diet, i.e. animal sources such as deep sea fatty fish, egg yolks, and liver, or from supplements. Few foods naturally have substantial vitamin D content, and dietary vitamin D is obtained primarily through fortified foods or supplements. Vitamin D2, which is found in some plants in the diet and is produced commercially by irradiation of yeast, is used for fortification and supplementation. Both vitamin D2 and vitamin D3 can be used for supplementation. Only a few foods, such as the flesh of fatty fish, naturally contain significant amounts of vitamin D. In the US, the other countries, cow's milk and plant-derived milk substitutes are fortified with vitamin D, as are many breakfast cereals. Mushrooms exposed to ultraviolet light contribute useful amounts of vitamin D. Both forms of vitamin D undergo identical metabolism. Some evidence indicates that vitamin D2 may be metabolized more rapidly than vitamin D3, but with regular daily intake, they can be considered bioequivalent. This is all Wikipedia again. Both forms of vitamin D are converted to 25-hydroxyvitamin 25-OHD in the liver, and the serum level of 25-OHD is measured to determine the adequacy of vitamin D status. In the kidneys, 25-OHD is hydroxylated to the 1,25 dihydroxyvitamin D, which is the only biologically active form of vitamin D. Acting principally on the duodenum, it increases calcium absorption. It also acts on bone cells, both osteoblasts and osteoclasts, to mobilize calcium. This is the figure that shows the metabolism. And this is the source of that quote. That's more sources of the quotes. Vitamin D has a significant role in calcium homeostasis and metabolism. Its discovery was due to effort to find the dietary substance lacking in children with rickets, the childhood form of osteomalacia. One of the most important roles of vitamin D is to maintain skeletal calcium balance by promoting calcium absorption in the intestines, promoting bone resorption by increasing osteoclast number, maintaining calcium and phosphate levels for bone formation, and allowing proper functioning of parathyroid hormone to maintain serum calcium levels. Vitamin D deficiency can result in lower bone mineral density and in increased risk of reduced bone density, osteoporosis, or bone fracture, because a lack of vitamin D alters mineral metabolism in the body. Thus, vitamin D is also critical for bone remodeling through its role as a potent stimulator of bone resorption. Vitamin D receptor expression decreases with age, and findings suggest that vitamin D is directly related to muscle strength, mass, and function. Studies on the role and benefits of optimal vitamin D are vast. Recent research suggests that it is more of a hormone than a vitamin, affecting 36 target organs with vitamin D receptors in nearly every cell. This vitamin deficiency is diagnosed with a blood test showing vitamin D level lower than 30 nanograms to milliliter. Studies show that excess weight is indirectly linked to low vitamin D levels. The more weight we carry, the more likely we're going to be deficient in vitamin D. In northern climates, studies show up to 61% of Americans are vitamin D deficient, going up to 87% in the winter months. Vitamin D deficiency is associated with chronic inflammatory diseases, including diabetes and obesity, both strong risk factors for cardiovascular diseases. The association of these diseases with vitamin D deficiency and improvement with vitamin D supplementation suggests its therapeutic benefit. The same study found increased inflammation in diabetes and/or obesity lowers circulating vitamin D levels. Another study found that low vitamin D levels have been associated with arterial stiffness, the loss of youthful suppleness that allows arteries to properly regulate blood flow and pressure. Importance of vitamin D for periodontal system. Number 1, increased inflammation in diabetes and/or obesity and periodontal disease lowers circulating vitamin D levels. Number 2, vitamin D sufficiency reduces inflammation and pro-inflammatory cytokines. Number 3, vitamin D supports immunity. Number 4, it reduces risk of infection. Degenerate cytokines are known to be responsible for much of today's chronic health concerns. Vitamin D3 regulates or balances cytokine production. The killer T cells of the immune system cannot go into battle and fight against an infection unless they find and attach to optimal levels of vitamin D3. Without vitamin D3, T cells do not engage. Reduced risk of infection. Vitamin D is required for the expression of cathelicidin by macrophages, which is involved in bacterial killing. A meta-analysis of 7 observational studies noted a reduced risk of active tuberculosis in those with the highest versus the lowest values of vitamin D. However, randomized controlled trials in the Western African population with baseline mean of vitamin D values of 31 nanogram milliliter showed no effect of 100,000 IU of supplemental vitamin D given at the beginning and at 3 and 8 months of tuberculosis treatment on the rate of sputum conversion or resolution of markers of clinical severity. But this may have to do with the study design. However, this dose of vitamin D may have been insufficient because of the increase in vitamin D concentration during treatment did not differ between the supplement and placebo groups. Vitamin D plays a key role in proper functioning of the immune system. Insufficiency makes a person more susceptible to disease or infection. Optimizing vitamin D levels boosts bone integrity of immune system and will reduce susceptibility to infection or disease. Very important right now in COVID times. Other benefits of vitamin D. The New England Journal of Medicine finds that risk of death for intensive care patients is about 45% for vitamin D deficient patients and only 16% for patients with sufficient vitamin D. Also very important in the times of COVID. Number 2, risk of stroke rises with age. Currently, about 6.8 million Americans live after having a stroke. In one study, having optimal vitamin D levels are associated with about 90% return in functional outcome after a stroke. Number 3, vitamin D levels have been linked to accelerated death of beta insulin-producing cells in cases of diabetes. Today, diabetes is considered the next epidemic. In one study, low levels of vitamin D are associated with mood-related issues and psychiatric disorders. Vitamin D receptors develop in the brain embryonically, suggesting that vitamin D is developmentally linked to brain and neurological function. In a long-term study conducted over 11 years with 1,650 mother-child pairs for about every 10 nanogram milliliter of vitamin D concentration in mother's blood during pregnancy, and in about 11% decrease of ADHD-like symptoms occurred. In another double-blind placebo study, 218 postmenopausal women are split into two groups. The group that supplemented 2,000 IU of vitamin D per day had 37% less inflammation in the body compared to the group that received placebo. In a study from the Journal of Endocrinology and Metabolism, 961 female nursing home residents over age of 70 are tested for vitamin D. The group with the lowest levels has 49% increased risk of mortality compared to the group with highest levels. In one therapeutic study, the normalization of vitamin D levels is shown to significantly improve the severity of fatigue symptoms of primary care patients. Vitamin D had shown to support respiratory health. Very important in COVID times. In a 2-year trial of vitamin D supplementation with 1,500 patients, healthy sleep patterns are linked to normal vitamin D levels. The most significant changes are seen when vitamin D levels are kept between 60 and 80 nanogram milliliter. This is a stretch time. How does vitamin D support immunity? Vitamin D expert Dr. John Cannell developed a theory that some immune issues are seasonal due to seasonal variations in sunlight, which cause fluctuations in vitamin D levels. Vitamin D activates genes that support immune response to foreign entities in the body. It downregulates pro-inflammatory cytokine activity and supports healthy inflammatory response. Supplementation. Vitamin D has to be tested as part of the annual exam and blood test because everyone has individual needs for vitamin D3 and retested again in 2 to 3 months if initial levels are not optimal. Dr. John Douillard's website, livespa.com, offers a home test kit as an alternative to lab blood drawing. The normal range is considered 30 to 100 nanogram milliliter. Most experts suggest keeping it at high end of normal between 50 and 80 nanogram milliliters. Many medical colleagues do not agree with that, and I had to argue with the PCP doctor of one of my patients that didn't want to give him a prescription, and the relatives didn't want to buy it out of pocket. But it is hard to convince medical community to agree with us on this. The recommendations on supplementation I'm using are from the same source, Dr. Douillard's website, livespa.com. Typical adult summer dosage is 1 to 3,000 IU. Depending on sun exposure, typical adult winter dose is 4 to 5,000 IU. Most supplements of vitamin D are made of fish. They can cause indigestion, do not absorb easily, and require extremely high dosages to bring blood test numbers to optimal range. Other supplements are made of sheep lanolin. Oil in their wool is loaded with pre-vitamin D, which mimics the way humans derive most of their vitamin D from sun. These supplements are most absorbable. According to Nobel Prize-winning circadian rhythm concept from 2017, vitamin D supplement should be taken in the morning with rising sun. It is coupled with the melatonin rise and fall with transition from dark time of the day to the light, the same way we would take melatonin at night. Can supplementation result in toxicity? Food and Nutrition Board had established the tolerable upper intake level, UL, as 2,000 IU day for adults. New research demonstrates this amount is very conservative, and it appears that it's unlikely that toxicity could occur in healthy people with doses less than 10,000 IU a day. Current understanding is that physiological requirements for adults can be up to 4,000 to 5,000 IU a day. Many authors discuss individual sensitivity to vitamin D, but toxicity is rare. One study showed that taking 4,000 IU a day for several years was completely safe, and only after taking 40,000 IU a day for several years is there a risk of developing toxicity symptoms. We should do our best to optimize vitamin D in the summer when the UVB rays are available. There is no vitamin D toxicity from the sun, as UVA rays break down excess of vitamin D. It is stored in fat cells, and we carry much of it into the winter months if we optimize it with summer UVB rays. Unfortunately, for the past 25 years, sunscreens have blocked out skin protective UVB, but not UVA rays. As it turns out, UVA rays are more abundant and penetrate deeper and are more harmful than UVB rays. Periodontal considerations. For those who don't know, most of periodontal research is done on beagle dogs, so smiling beagle dog is a joke. Periodontal disease concept uses now universally accepted germ theory of disease for pathogenesis. Louis Pasteur had contributed in development of this theory and provided scientific proof of the concept about 150 years ago. Robert Koch is credited for formulating 4 postulates, basic criteria for disease to be caused by certain bacteria. The third postulate states, the cultured microorganism should cause disease when introduced into a healthy organism. The third postulate specifies should, not must, because as Koch himself proved in regard to both tuberculosis and cholera, not all organisms exposed to an infectious agent will acquire an infection. Non-infection may be due to such factors as general health and proper immune functioning. This is so up to date with the current situation with COVID, and this is the statement that should apply to COVID concept as well. Acquired immunity from previous exposure or vaccination, or genetic immunity, as with the resistance to malaria conferred by possessing at least one sickle cell allele. So there we see the concept of immunity appearing at the end of the 19th century at the same time as pathogenesis theory. It is a coupled concept describing a relationship between the host and a pathogen. They work hand in hand, and it seems that pathogens got more attention from clinicians with invention of antibiotics than host. Germ theory works well for us in case of abscesses or known red complex bacteria. However, even in cases of straightforward antibiotic treatment, antibiotics initially kill or halter bacterial cell growth, and then immune system finishes the rest of infection off. That was the understanding of how the antibiotics work, which is changing currently. New findings point at alteration of immune function with antibiotic use. We as clinicians are forced to celebrate immunity more and more and educate our antibiotic demanding patients about that. On this note, I want to loop back to antibiotic-resistant bacteria. That is part of the reason I was challenged in my practice, and so are majority of medical professionals in the 21st century. The problems stem from the way our food and environment are handled and goes beyond medicine, as you are all well aware. Contrary to antibiotics, one treatment modality that accounts for host response is periostat, low-dose doxycycline, that reduces the activity of host-derived enzymes, such as collagenase, and reduces inflammation. It works really well, and the effect can linger after discontinuing of the drug for another 3 months or more. Oral diseases are the most prevalent chronic conditions in the world today, affecting all populations throughout the lifespan. In particular, it has been estimated that severe periodontitis contributes to 3.5 million disability-adjusted life years. This was the latest journal I saw this in. To me, it seems that optimizing the levels of vitamin D is a step further in host modulating response that is sustainable. Doing what we are trained to do, treat and prevent oral diseases with the support of optimally functioning immune system, is not only easier but more effective. Periodontal care is like slow food concept. It takes time. It can't be skipped, condensed, and done in one day. It takes the whole body and general health into account. But you get really well rewarded. Thank you so much for your attention, and I appreciate you listening to me. Thank you. This was Katerina Laripova. I'm a periodontist in Bennington, Vermont. Thank you.